Hey everybody, today Lauren and I are going to demonstrate how to place a central venous catheter or central line. And this type of catheter would be used if a patient is needing fluid therapy or medications delivered intravenously for greater than 72 hours. And also, you can use this type of catheter for serial blood sampling if that's needed and to monitor central venous pressure. Um, some types of patients that would benefit from the use of this type of catheter over a peripheral catheter are patients with diabetic ketoacidosis or DKA, and also patients suffering from parvo. Um, this type of catheter can also be used to deliver total parenteral nutrition. And we will be placing a multi-lumen catheter today, and we hope that you enjoy the video. Thanks a lot.
So you would have scrubbed your sterile field with sterile gauze, and you are placing sterile gloves on. We used just latex gloves, and you will drape your field. There's our Vanna with sterile towels. And if you have towel clamps available to you, you can use those to keep your drapes in place. So for this dog, I did a cut down prior to advancing my catheter. This will help you tremendously in advancing your dilator later in the procedure. So the first thing that you're going to do is grab your needle that all the kits come with. It's just like a stylet in a regular catheter. And you're going to feed it into the vessel until you get blood back. Normally you don't have to do this, but because it was a cadaver, we had to draw back a little bit. And normally your assistants will not be grabbing things off of your sterile field. Then you will take your guide wire and advance it through your needle. I advanced it about halfway before pulling back a little bit and taking the guide wire out of the plastic tube. Then you are going to take out your needle, leaving your guide wire in place, being careful not to ever have hands off of your guide wire as it can slip into the body. Then you'll take your dilator and feed it over your guide wire. And advancing it through the skin, which can be kind of tough, which is why doing a cut down at the beginning of the procedure will help you so that you don't have to fight the skin too much. And you might have to do a little bit more of a cut down on top of the one that you've already done, and that's okay. When you advance your dilator, you want to make sure that you advance it all the way to the hub of the dilator. The point of the dilator is to not only dilate the skin, but the vessel walls, so that when you place your central line, you don't fight going through the vessel wall with it. And you don't have to leave it in for a certain amount of time. You can just advance it and then pull it out. Again, being careful not to lose your guide wire. You always want to make sure that you have hands on the guide wire. Then you will take your central line that's flushed with saline and advance it over your guide wire. It will always come out the same hole in your catheter, which is the white ended lumen. So you're going to advance it all the way to the hub of the catheter, and then you will pull out your guide wire, flush your catheter, make sure that it's still in place, and draw back. Then you'll clean up the area a little bit with some gauze because blood will come out. Blood will come out. Then you will take some suture and you're going to suture it in place. Thank you for watching our video, and that's how you place a central line in a dog.